fix facial aesthetics. He did a terrible rhinoplasty on her. The nose doesn't fit with the face. And when the time goes by, we develop a more comprehensive, a more thorough analysis and diagnostic process that can end up with a good facial balance and also a good facial occlusion, a good breathing airway. And we have a specialty that has several specialists like surgeon, orthodontist, prothesist, periodontist, and dental technician. Everybody's involved in a good diagnosis and a good treatment planning for the patient. So our protocol starts basically with a good facial analysis. It's capital. Facial analysis is very important for the diagnosis. The face can tell everything the patient needs. I don't mean that you have to throw away the cephalometric analysis or dental models or whatever. You have to use everything you have in hand. But facial analysis is a powerful tool that you have in hands, and you doing a good facial analysis, you have a proper diagnosis. In nowadays, it's not conceivable to work without nice photograph. You have to have good photos with the patient, good photo workup with the patient for analyzing the patient doing down the road. Only not only on the consult on the appointment, but you can see 2, 3, 4, 5 times the facial analysis of the patient, and you can do a better diagnosis down the road. 3D tomograms is readily available and it's not costly, at least here in Brazil. It's readily available. And we work also with a program that you